first started practicing more than 20 years ago, and diagnosing AMD was very difficult. The treatment was almost non-existent. My perception of macular degeneration, or AMD, prior to having AdaptDx, you truly didn't have AMD until you had clinical signs, subjective signs, and pretty much some disrupted vision. We thought we were catching it kind of early in the game with the technologies that we have, but in reality, you get a new piece of technology and you realize that you don't know what you don't know. The results of the AdaptDx surprise you when you don't see any clinical findings, you don't have any drusen, you would have absolutely no clue that this patient may have a subclinical case of macular degeneration. They do the screening test and it's a pass-fail, they fail, but you saw no clinical signs. So without their complaint and without this test, there would have been really nothing offered to the patient. There would have been no treatment, there would have been no testing, and they would have walked out the door with a new eyeglass prescription thinking everything was 100% okay when it's not. So that's very powerful. The AdaptDx has made it so much easier to care for our patients who have both subclinical and clinical macular degeneration, because it empowers us to monitor them, to know if they're stable. I would highly recommend that a doctor purchases the AdaptDx. They're going to pick up on these subtle signs much sooner. The quality of care that they're going to give to their patients is going to change. Their protocols around macular degeneration are going to change. It's very, very helpful. I would highly recommend the AdaptDx for any optometrist or ophthalmologist that I know.